Hi, I'm Kayla Grotrian. I'm a second year MAT student at Manchester University, and today I'm going to be talking about Taijin Kyofusho, which is a Japanese culture-bound syndrome. So what is Taijin Kyofusho? It is also known as TKS, which is what I'm going to refer to it as for the rest of the presentation because I'm probably butchering the name of it, and I'm very sorry about that. But it is a Japanese form of social anxiety disorder that occurs in about 10 to 20% of Japanese people, and it's more common in men than women. So these are some symptoms that are common with social anxiety disorder between TKS. So there's blushing, inappropriate eye contact, shaking, difficulty speaking, sweating, GI distress, a strong desire to flee the situation, and patients that are experiencing either of these usually simultaneously crave and fear interpersonal interactions, and then they may become gradually more and more withdrawn in an effort to avoid the fearful reactions. So how do they differ? And this all goes back to the differences in Western and Eastern cultures. So social anxiety disorder is more of a Western medicine disorder, and therefore kind of has a more Western self-centric way of thinking, because we all know in the West, at least in the USA, it is usually self first, others next. So with the social anxiety disorder, they have more of a fear of experiencing embarrassment themselves in front of others, whereas TKS is specific to Japanese culture and has a more Eastern way of thinking, which means that they think about how things affect others first rather than themselves. So instead of having fear of embarrassment for themselves, they fear that by being around other people, they're going to cause those people embarrassment. And they have 4 specific subtypes of TKS. The first one is, and I'm probably going to butcher these names too, so I'm really sorry. I tried to look at pronunciations and get it right, but it's going to probably be a little rough. Seikimen Kyofu, which is a fear of blushing. There is Shubo Kyofu, which is a fear of a deformed body. And then there's Jiko Shisen Kyofu, which is a fear of one's own glance. And there's Jiko Shu Kyofu, which is a fear of body odor. There's also 4 subtypes that are based upon severity. So there's transient TKS, and that's short term. It's moderately severe, but it's most common in teens. And that will go away eventually. There is phobic TKS, which is chronic. It's the most common type of TKS that you're going to see. It is moderate to severe and often begins before age 30. And then there's also delusional TKS, which is where a person obsesses over a particular personal flaw of the body or mind, and then that can change from thing to thing. So it could be, say, their eyes one day, and it could, after a period of time, change to they're going to obsess about the way that their arms look or the way that they smell or something along those lines, but it just can continually change. And then there's phobic, which is schizophrenia, and that's kind of separate than TKS, and it's more complicated because the TKS in that part is part of the sufferer's schizophrenic reactions and not just a simple phobia of the fear of embarrassing others. So the treatment for TKS in the Western culture, they don't really recognize it as a separate disorder. So they just treat it the same way they treat social anxiety, which can include medication, therapy, talk therapy, work therapy, things like that. And then in the Japanese culture, the Japanese clinicians practice Morita therapy, which is a highly regimented process that helps the patient to accept and redirect their thoughts. And that consists of 4 stages. So the first stage is the patient is on bed rest and social isolation. For the second and third stages, they focus on work. Then the 4th stage is more therapeutic techniques, which you would more recognize in the Western culture, like work therapy, talk therapy, things like that. And then today, they modify the Morita therapy for outpatient or group settings. So stage 1, the social isolation, probably isn't as common nowadays since they've started to include it as outpatient or group settings. Yeah, this is my source where I got my information. It was written by a journalist that has a lot of interest in culture-bound syndromes, and then it was fact-checked by a medical doctor. So yeah, I hope that that kind of provides some education on TKS and a culture bound syndrome. I know when I started this, I had no idea that this was even a thing. So it's very interesting to learn about. And so have a great day.